Okay, we're going to get started here. Okay, we ready? Hey, good to see you again. Yes. Okay, great. We're going to begin our joint Nueces County, City of Corpus Christi COVID-19 press briefing. I'm Peter Zanoni, Corpus Christi City Manager. And today we have a few presenters to keep the community up to speed on how things are going locally here with COVID-19. I will provide an update on the statistics that we track every day, things like the number of cases, number of persons recovered, and so on, and provide a quick update on the firefighters that were in quarantine yesterday. We reported that, but they're out, and I'll tell you why. And then also talk to you about the small business and residential assistance programs that are out there, just to remind residents of the numbers and websites to access if they have any questions and if they need assistance, because there's dollars that are available. Nueces County Judge Barbara Canales usually joins the mayor on a Thursday. Today's Thursday, but she is unable to today, so I'll just do a quick update for her as part of my remarks. Our local public health director, Annette Rodriguez, is here, and she's going to talk to us about the successful drive-through testing that we did today at the former Memorial Hospital parking lot. We did a record number of tests, samples, or specimen collections from there today. Also remind us of the CPAP and BiPAP. Those are breathing machines that can be donated. There's a donation program. She'll talk to us about that. And then just remind us, which is probably one of the most important things, of the precautions that we need to take to minimize the spread of the virus. And then Mayor Joe McComb of Corpus Christi will talk about his disaster recovery fund, tell us that there's a show you can watch tonight that he and I and the judge and a few others were on, a virtual town hall. It will be on tonight. He'll tell us about that, and then provide an update to us on how he's handling the governor's orders with respect to any orders of our own for Corpus Christi. Okay, so with that, I'll begin with the statistics. Do you want to translate? Or? Okay, all right. Okay, so every day at 4 o'clock, we look back at the past 24 hours to see do we have any new cases and how are people recovering. And so since yesterday at 4 o'clock, we're confirming 3 new COVID cases. So that does put us over the 100 mile or 100 count mark. We're at 102 cases then in the Nueces County area. The graph shows us on the chart the past 7 days. And you can still see we have some low days with 1 and 2, several zeros. We had a big spike on Monday, but today we're at 3 additional cases. So 102 in total. We're still tracking only 3 deaths for Nueces County, and that includes a Corpus Christi resident, a resident from Robstown, and then a second Corpus Christi resident, but who passed away while he was working as a traveling nurse in Nevada. But we're required to count him here in Corpus Christi since he had a home here and his permanent residency was here. The number of male-female distributions, the 3 new ones that were added to our count include 2 male and 1 female. And so it's 54 total males and 48 females in our count. When we look at the age group, we track ages in 9 different categories, a 0 to 19, and then a 20 to 90 plus. And the 20 to 90 plus are different by 10-year increments. And the 6 age categories in that 20 to 80 to 79, those 6 age categories pretty much have an equal distribution of the number of cases that we've had in our community or do have. And then testing is important, and so we'll report on that as well. We have 2 measures on testing. How many tests have we analyzed in the laboratory setting? And this is different from test specimens that we've collected, but rather how many tests have we performed with microbiologists, trained personnel to see is somebody positive or not. And we did 42 of those in our labs today. That was out of the 130 some odd drive-through tests that we did. We were able to get through 42 of them since this morning. And then the hospitals, clinics, and private physicians reported to us that they have sent 81 specimens to be tested at the commercial labs like a LabCorp or a Quest. So to date, we have just over 2,500 tests that have been administered and analyzed in our community, 2,564 to be exact. When we look at recovery rate and who's in the hospital, this is an important part of our update every day. So we started showing this graph about a week and a half, 2 weeks ago. And the confirmed case, the number of cases that have recovered was a pretty small sliver then, but as time goes on and the fewer cases we get, more people recover. So today we're at 53% recovered, and it's a total of 54 persons, or 53% persons have recovered, and you can still see 54 still. Okay, here it is. Sorry, I was looking at the wrong color. So 54 recovered, and the smaller slice is the numbers that is still active, 48 persons active. Since we've been tracking this, there have been 22 persons in the hospital or have been hospitalized for COVID-19. Yesterday, we had just one person in the hospital, but since yesterday's report, 4 additional persons have been admitted to the hospital. So today we have a total of 5 in the hospital, and one of those 5 is in intensive care. And then where do the individuals live that either have COVID or who have had it? We report that as well every day. And of the 102, 86 of those persons live in the city of Corpus Christi. 2 of the new ones that we're reporting today are from Corpus Christi. And then we have 2 from Robstown, 7 from Port Aransas, and then 7 today from the rural Nueces County. Yesterday there was 6, but one of those 3 is from the rural Nueces County areas. Okay, so that's an update on the statistics. We'll do a quick translation in Spanish at this point.
En las últimas 24 horas han sido 3 los casos reportados en el condado de Nueces. Actualmente existen 102 casos confirmados. Entre esos, 54 son varones, 48 son mujeres. La mayoría se encuentran en el rango de edades entre 30 y 49 años. En total, se han llevado a cabo 2.564 pruebas entre hospitales y el Distrito de Salud Pública. De los 102 casos, 86 son residentes de la ciudad de Corpus Christi, 2 son residentes de Robstown, 7 son residentes de Port Aransas, 7 son residentes de áreas rurales. Desafortunadamente, son 3 los fallecidos. 54 de los 102 casos se han recuperado por completo, 21 han sido hospitalizados, 5 continúan en el hospital y 1 está en condición crítica en cuidados intensivos.
Okay, thank you. All right, I'm going to do at this point just a quick update for Nueces County Judge Barbara Canales, and so she apologizes that she couldn't be here today. But the message from her is that Tuesday when she was here, she talked about some additional orders that she has drafted in response to the governor's orders that he talked about Monday at his press event, and that go into effect tomorrow. The county's additional orders that were drafted pretty much to mirror what the governor has set forth for the state go into effect tonight at midnight. And those orders can be found at the county website, Nueces County website. The message on these is that they go into effect tonight. They're pretty much consistent with the governor's orders, but they do apply here locally. And so anyone interested in wanting to review those to make sure we're up to speed on them can go to the Nueces County website, which I believe is not on that screen, but you can see the orders here that are consistent with the governors to include restaurant capacity at 25%, retail and malls and restaurants, theaters and museums can open, but only at 25% capacity. And so the judge's orders for Nueces County are consistent with those that are there. And then the actual document itself that the judge has drafted and signed is on the website, on the Nueces County website. Okay, and then one update on our first responders. So yesterday we reported 4 initially, and then by the end of our briefing, it was downgraded to 3 firefighter responders that were put into quarantine after transporting a 1-year-old patient to the hospital. They had adjusted some of their PPE through that whole process, and that infant, while at the hospital, was determined to be a candidate for COVID-19 testing. And so because the paramedics did make some adjustments in their goggles primarily, and wanting to make sure we're taking care of our employees, we put those 4 firefighters in a quarantine situation. By the end of the press briefing, it was determined that one didn't do anything that caused them to need to be put into quarantine, and so we removed that person yesterday. Since yesterday, we have learned the test results for the infant, which were negative. So this afternoon, the remaining 3 firefighters were taken out of quarantine. They'll be back to work, I think, tomorrow. So that leaves us with 0 firefighter persons in quarantine and 0 police officers in quarantine for the city. Okay, and then finally, just a quick update on help for those that might need it. The City Council, through their policy action and as a body, voted to put monies in funds to help small business persons with business recovery loans. We are working with Lift Fund, which is a private or nonprofit firm. They're a micro lender. And there's over $2.7 million available for the community, the business community, to be considered a small business of the company or the business gross profit, gross revenues, excuse me, are no more than 1.5 million annually. So if they make 1.5 or less in revenues, then they can be eligible for this program. The number to call is on the screen, 888-215-2373, and then the application is online at liftfund.com. So that small business recovery program is still available, and we encourage people to either call a Lift Fund representative right here in Corpus Christi or visit that website for more information. And then if people need help with their rent, mortgage, or utility payments, City Council approved $1.6 million in funding that we got from the federal government as supplemental funding. And in this case, we're partnering with 2 nonprofits that we have used for many years as well for similar programs. And a resident that's either a renter or a homeowner that has a mortgage or a rent payment or utility payments where they've had a drop in income because of the economic downturn, they can call either one of the 2 agencies that are on the screen, the Corpus Christi Hope House or the Salvation Army, both taking applications for either of those persons, a renter or homeowner. And the Hope House number is 361-852-2273, and the Salvation Army 361-884-9497. So $1.6 million available. There's still a lot of funding available. We encourage persons that may need to take advantage of that to don't feel bad. Call those numbers, get an appointment. And the same thing with those small businesses that are out there. We put this, we recommended and City Council approved that funding to help small businesses out, and we encourage them to call and take advantage of that. The loans in the small business side are 0% loans with a 4-month deferment, and that'll help them with payroll or just keeping their business going during this downturn. So that concludes my portion of the presentation. We're going to get that translated into Spanish, and then Annette Rodriguez will come up and talk about some of the health matters. Thank you.
En resumen, hoy la juez Bárbara Canales no pudo acompañarnos, pero en su ausencia les quiero recordar que las nuevas directrices del condado van a reflejar las directrices del estado, mismas que fueron emitidas esta semana y que entran en vigor mañana. Esas órdenes son parte de la fase 1 de reapertura del estado e impulso a la economía, y que incluye que los negocios como tiendas, restaurantes, centros comerciales, cines y museos podrán operar al 25% de su capacidad. Les pido leer el reporte del gobernador, el cual está disponible en línea en el portal www.cctexas.com/coronavirus. La información más reciente sobre los bomberos paramédicos. Ayer le informamos que 3 paramédicos habían sido puestos bajo cuarentena tras estar en contacto con un bebé quien presentaba síntomas parecidos al coronavirus. Después de que el bebé resultara negativo al virus, los bomberos fueron removidos de la cuarentena y regresarán a sus labores normales el día sábado. En cuanto a los préstamos a pequeños negocios, le queremos recordar que si usted quiere solicitar un préstamo, acuda a la página www.liftfund.com y llene el formulario. Una vez que tenga toda la documentación necesaria, el trámite será más ágil, o también puede llamar al 1-888-215-2373. Si necesita asistencia para pagar su renta, hipoteca o servicios como agua y luz, puede llamar al Ejército de Salvación al 884-9497 o a la Casa Esperanza al 852-2273.
Thank you. Annette Rodriguez, Public Health Director. Today's drive-through was very successful. We had 131 specimens collected, and we continue to see a significant rise in the number of appointments being scheduled. The turnaround time for tests resulted in our laboratory is usually within the same day. However, due to one of the extractor machines being down, the turnaround time could be 2 or 3 days to result out all 131 specimens. Specimens will be batched in groups of 21 and will take approximately 12 to 13 hours to complete. Tomorrow is the last day to drop off the sleep apnea machines at the Del Mar West Campus at 4101 Old Brownsville Road from 3 p.m. to 6 p.m. Thank you again to those who have already donated and to the hardworking team at Del Mar College. The Del Mar team consists of faculty, staff, and second-year students with the respiratory therapy program. Please remember to continue to practice good respiratory and cough etiquette. Cover your mouth and nose with a tissue when coughing or sneezing. Use the nearest waste receptacle to dispose of the tissue after use. Perform hand hygiene, hand washing with soap and water, alcohol-based hand rub or antiseptic hand wash after having contact with respiratory secretion and contaminated objects or materials. These simple but effective measures will help slow the spread of COVID-19. Tomorrow, there will be more people going back to work and a lot of businesses reopening in some capacity. This does not mean that the crisis is over, nor does it mean to slack off on good infection control measures. Continue social distancing of 6 feet or more, wear your face mask in public, and avoid non-essential travel. Be cognizant of your surroundings. We have nearby counties such as Cameron and Hidalgo County in the Valley and many others that are experiencing a significant increase in COVID-19 cases. Cameron County has over 400 cases and 17 deaths. This is just a 2-hour drive south of us. Our hearts go out to them and our public health partners that are working around the clock to mitigate this virus. Before you go anywhere, please check our website at www.cctexas.com/coronavirus to help protect your health and the health of your family. Your efforts to help save lives doesn't go unnoticed. Stay well, and as always, stay informed. I will now turn it over to Mayor McComb.
En resumen, la toma de especímenes de hoy tuvo éxito. Fueron 131 las tomas de pruebas realizadas esta mañana. Normalmente se reciben los resultados de estas pruebas el mismo día, pero debido a una falla técnica en una de las máquinas, no tendremos los resultados hasta dentro de 2 o 3 días. Mañana es el último día para donar sus máquinas del apnea del sueño en el Colegio del Mar, Campus Oeste, ubicado en el 4101 de Old Brownsville Road, de 3 a 6 de la tarde. Gracias nuevamente a los que donaron y al equipo del Colegio del Mar encargado de la desinfección de los mismos. Le queremos dar varias recomendaciones para aquellas personas que tosen en público. Cubra su boca y nariz con un pañuelo desechable al toser o estornudar y tírelo en un bote de basura. Lave sus manos ya sea con agua y jabón o con un gel antibacterial después de haber estado en contacto con secreciones mucosas. Estas medidas son simples pero efectivas y ayudarán a retrasar la propagación del virus. El día de mañana habrá más personas que volverán a trabajar y muchas empresas volverán a abrir de alguna manera. Eso no significa que la crisis haya terminado. Continúe practicando el distanciamiento social de 6 pies, use un cubrebocas si va a estar en público y le pedimos evitar viajes no esenciales. Condados cercanos como Cameron e Hidalgo, en el Valle de Río Grande, están experimentando un aumento significativo en los casos por coronavirus.
Joe McComb, Mayor, and first I want to thank Gabby for her translating day in and day out. That's a talent and an art that I don't have, and she does, so thank you very much for that. Just to bring you up to date on some things today, remind you that the orders of the governor and the county judge and the cities all expire at 11:59 tonight, and the new orders that you've heard discussed go into effect. And so that places an increased burden on the citizenry of Corpus Christi and Nueces County, that you're going to be out and about, traveling around the territory, and we encourage you to pay attention to the social distancing and to maintain the washing of the hands and taking care of yourself. Just think of what your mother taught you back when you were a child. Make sure you wash your hands, stay away from sick people, and if you're sick, don't go around well people. So it's common sense, and the more we adhere to those general principles that we were taught years ago, we'll maintain the ability to move around. The governor's indicated, and I don't think there's any hesitation in his voice, that if we see these numbers take a turn up instead of a turn down in the number of cases, we could be back at home, and I'm sure you don't want to have that happen anytime soon. So we're asking for your participation and increased participation and commitment to following those rules and regulations. In the meantime, we've been out trying to help people that do need help and help the people that need help. And so several people have asked how are we coming on the Mayor's Disaster Recovery Fund. I'd like to give you a little update on that. Earlier this week, we distributed 8 donations to 8 nonprofits here in town, in the region, for a little over $107,500. And that was the Amistad Community Health Center, the ARC Assessment Center and Emergency Shelter for Youth, the Bethune Early Childhood Development Nursery, Coastal Bend Wellness Foundation, New Life Refuge, Mother Teresa Shelter, Nueces County Mental Health and Intellectual Disabilities, and the Wesleyan Community Center. And they are helping people that are dealing with this COVID-19 issue in different ways that they can provide the services for them. And these gifts were the result of really 2 gifts, one an $80,000 anonymous donation and a $10,000 gift from the Earl C. Sams Foundation. We appreciate that very much. And these were in addition to the $50,000 that were given out last week, $25,000 to the food bank and $25,000 to the Salvation Army. And so with the last 2 weeks, we've distributed $157,500 to try to help people in our community. And we want to thank all of those that have donated to that. These nonprofits have been struggling because there's increased demand on their services, and those contributions have been very well appreciated and received. Tonight, if you want to hear some further discussion on what's going on, Representative Michael Cloud, County Judge Barbara Canales, City Manager Peter Zanoni, Annette Rodriguez, and myself are going to be on a town hall meeting. It starts at 7 o'clock on Channel 6, KRIS, KZTV Channel 10, the CD South Texas, KDF, and Telemundo. They ask questions, and you get some answers on some interest that you may have about what's going on. And so we'd encourage you to watch that. And again, tomorrow starts phase 1 of the governor's plan. We had another conference call today with Senator Hinojosa, Representative Todd Hunter, Adriana Cruz with the State Executive Director of the Economic Development for the state of Texas out of the governor's office. We're preparing to begin to move forward, but at the same time, we want to move cautiously and realistically, in that we want our communities to come back stronger than they were before. So we want to thank everyone again for their participation, their support of the rules and regulations that we've had in the past, and realize that you're going to have to step it up game up a little bit as we go into the new phase, because we want to be successful to get into phase 2 and then ultimately to phase 3. But I think we've got a lot of faith in our citizenry, and we're counting on you to come through with us on that. Since the judge isn't here today, I guess, Peter, we'll turn it back to you to finish up any questions that you have. But again, We want to thank you, and as a side note, I think as many times as our firefighters have been in quarantine, we've got the healthiest group of firefighters in the country. They've been tested, I don't know how many times, and they go through this. So that's a good sign for our community that they've had potential exposures, and they've come out very well on these. So we're glad for that, and that's a good report. We're glad to get that report every time we can. So, Mr. Manager?
En resumen, quiero recordarle que nuestras directrices actuales expiran a la medianoche y las nuevas directrices entran en vigor. Mantenga el distanciamiento social y no esté cerca a una persona enferma. Sobre todo, tenga sentido común. Esta semana distribuimos una donación de más de $107,000 a 8 organizaciones. 2 de los donadores realizaron una donación anónima de $80,000 y la Fundación Earl Sams donó $10,000 y les agradecemos. Si usted quiere escuchar más sobre las medidas que hemos tomado, lo podrá hacer viendo un programa. Se trata de una reunión pública televisada esta noche a las 7 por el Canal 6, el Canal 10, CW South Texas, KDF y Telemundo. Entre los temas a tratar se trata de los impactos locales por la pandemia, la capacidad para realizar pruebas, la reapertura a la economía y la información más reciente sobre desempleo y los distritos escolares.
Okay, great, thank you. Just a few closing remarks, and then we'll see if there's any questions from the media. So through this past 8 weeks, we've had a lot of people step up to the plate and help out the community, and they've also helped out city employees with many gestures to include lunches or breakfast or food in general. And so this week, the Water Street Oyster Bar and the Drunken Noodles is the name of a restaurant. They provided lunch to the public health staff this whole week, or most of the week, right? So we know firsthand that that's really appreciated. There's nothing like a good meal, especially after you're working 10, 12, 14 hours and you haven't had a day off in many days. So we want to thank the Water Street Oyster Bar and the Drunken Noodles for stepping up to the plate and taking care of our health employees at the health district or health department. And then just one final comment is tomorrow we'll have our final press briefing for this week, and it'll be myself and Annette will be here, our health director. But our guest presenters tomorrow will be Texas A&M University. Dr. Tussaud and Dr. Bird will be presenting new information on some of the stay-at-home or social distance, stay-at-home, I guess, information that they've been tracking via cell phone usage. And as well, they will be providing updates to the modeling that they've been doing now for a couple of weeks. I believe this is their 4th presentation, and the first 2, the first 3 were pretty decent. Last week's was very well delivered and probably the best in terms of crisp information. There was a lot of information in the first 2, which we needed. Some of the feedback from the community was make it a little more simple, and so that's what we did last week, or the professors did. And then tomorrow will be a similar presentation like that with updated information. And so we encourage you to tune in. It'll be at 5 o'clock. Annette and I won't take too much time talking, so probably shortly after 5, you'll be able to listen to Dr. Bird and Dr. Tussaud on their updated modeling for our area, showing things like the curve and when we hit our peak and what does the future look like. And we had several conference calls with them this week, but they want to try to model out with the 25% restaurant business opening, what impact would that have on the number of cases, and using models that every other state and country uses, and using information from our region and Texas in particular. They'll be able to show us some projections on number of COVID persons getting the virus and or a number of deaths. And so with that, we'll open it up if there's any questions from the media for either myself, the mayor, Mayor McComb, or Annette.
When is the next mobile testing date?
The next mobile event is Monday. It'll be this Monday, May, whatever that May is, May 4. Yeah, same location.
Okay, what are the strategies right now as it pertains to tourism, particularly because of virus import concerns and beach crowding concerns?
Yeah, so the question is, I don't know if the mayor wants to weigh in on this, but tourism and potential beach crowding. So that's a concern of ours. We know that persons coming in from much higher infected areas is something that we need to be mindful of. The business community, we've asked them, and we know we didn't even have to ask them, but we know that they're going to step up to the plate and make sure make sure that 25% capacity rule from the governor is adhered to. Our police department and sheriff's office are here and work every day of the week. And so we're managing and watching the beaches. We're working with the judge and a coalition that she put together that works with the federal government and the state government and then our local governments to provide more information at the beaches. And so that people know to distance at the beach, know that there's more than one section of the beach. We have 20 miles of beach down there. And those are some of the strategies we're using. We're going to watch it closely. We'll see what happens to cases over the next couple of weeks and may make additional adjustments if we need to. That's a good question.
Just one, I don't
Yes,
know
sir.
if you can answer it or the judge can answer it.
Okay.
Businesses out there that have a face mask policies for their businesses, can they enforce that? Ask people to leave if people aren't wearing their masks?
Yeah, I don't think so. Well, I guess maybe they could if it's private. Do you know, Mayor? The question is if the governor didn't require face masks, but if a business in Texas, or at least our county, says you have to wear a face mask or you can't come into the place, is that enforceable?
I don't think if it's a private owner,
Yeah.
he's got the right to wear a face mask going in, but no law. They're not breaking any law, but if you want to do business and they ask you to wear it, not under fear of penalty or fines or anything, so that's a private sector decision.
Yeah, that sounds about right. We'll see if we can get any additional information at our briefing tomorrow. But to go into a private establishment, you have to, there's certain things you have to follow, I guess, to get into there. So, yeah. Right.
We couldn't go into the hospital when my grandbaby was born, but that was the hospital's rules, not the city's.
Yeah. Good question. The city doesn't, some cities, like San Antonio, they require citizens to wear the face mask, but the governor has not, so it's not punishable by fine. Yeah. Okay, do we have any other questions for today? Okay, well, we want to thank the media for being here and thank the persons out there that are watching via YouTube, Facebook, some of the channels that carry this or any other mean. We're glad you're tuning in. It looked like there were a lot of people today, at least on Facebook. And we appreciate you watching and sharing this information with the community. As Annette said, keeping informed is the best way to keep everybody safe. So we'll see you all tomorrow. Thank you.